comes in and ministers, and she starts gasping. My sister runs out the door.
Okay, I've been tagged in this post a million times, people asking me like, what the heck is he talking about? Let me explain the video, and then I'm going to explain what I think is happening here. This is not a political post, so I don't want to see anything about politics in the comments. Gavin Newsom, our California governor, is talking about his mother's death. He says his mother did assisted suicide, his words, not mine, and at the end of her assisted suicide, she was gasping for air. Now, people are confused because they're like, I didn't think that was legal, and why was she gasping, Julie? So let me explain what I think is going on after I did some research. So, death with dignity is legal in 12 different states in the U.S. California is one of those states. However, doctors do not administer any medication. It's a powder you mix with liquid, and the person who is taking this medication drinks it on their own and ends their own life if they meet criteria and have a terminal illness, yada, yada. Now, in 2002, when his mother died, this was not legal, nor do we ever call it assisted suicide. So here's what I think happens. A lot of times, people with chronic life-limiting illnesses will end up in the hospital time and time again. Towards the end of their disease, they start being like, I am over this. And they're admitted into the hospital. They're on a bunch of medications, possibly machines, keeping them alive. They can say to a doctor, I'm over this. I'm done. I want to get off all these medications. I want to get off all these machines. Doctor will say, that's okay, but if you do, you will die. Like soon after. They say, that's fine. I'm okay. I want to go. And the doctor will say, okay, pick a day. And when we do that, we'll give you medication to make you comfortable, which is usually like fentanyl, morphine, something, Versed, something so you are comfortable while you're dying. If you're not in medical care and you're not used to talking about this, you may talk about that as assisted suicide or call it that. It's not that. You're dying anyway. The doctor's just there to help you be comfortable. I bet that is likely what happened. The doctor came in, administered medication. It probably was something like a sedative just to make her comfortable so she can die peacefully. Now, why was she gasping for air? I don't want to take away his experience, but usually at the very end of life, people have breaths, the changes in breathing, and those breaths look like gasps for air. But really, it's just end of life breathing. It's called agonal breathing, and it's a reflex the body does at the end of life. If no one tells you that, you can feel really scared and you think your loved one is gasping for air. So that's what I think is happening. Gavin Newsom, if you need more questions answered, talk to me. Hospice Nurse Julie.